In tonight's Multicultural Report, disparities in how the city responds to opioid overdoses in communities of color. News 8 multicultural reporter Malia Van Ostrand takes a closer look at those and the stigma surrounding opioid overdoses.
Black communities in Indianapolis are continuing to experience more opioid deaths than in other communities. But through outreach and education, one organization is hoping to bring those numbers down. Lack of awareness, misinformation or stigma, and structural racism. Those are a few of the issues that can create disparities in certain Indy zip codes. They can also lead to longer emergency response times, a disparity that means a difference between life and death.
People would say, you know, we called and they came 30 minutes later, or we called and it was 45 minutes. It was too late for them to come.
There aren't exact numbers on what those response times are, but Crabtree says those disparities are real. A big factor is the fear of being mistreated by law enforcement, which delays people from calling 911 or asking for help, even if they have naloxone, more commonly known as Narcan, available.
If you got this, you must be involved in drugs some kind of way, and that type thing. Although the laws are in place, also the Good Samaritan laws, you're protected under the Good Samaritan laws and Aaron's law, there's still that disparity.
Misconceptions about opioid addiction and what the medical condition entails can also deter people from seeking help. But resources from community organizations inside marginalized communities may be the key to bringing the numbers down.
2021, the overdose rate for our Black community in Marion County was 198 and has now gone down to 144.
Anton says that's due to more outreach by programs like Macro B and Soul, which aim to reach more marginalized groups, including LGBTQ+ and non-English speaking populations.
We do a lot of outreach in Marion County. We pass out naloxone and test strips to the community, and I really think that did have an effect on the decrease.
Zip codes 46202, 205, 208, and 218 have the highest numbers of opioid overdose deaths in the Indianapolis Black community at 70%.
At the end of 2023, we did see a decrease of 27% of the body counts in the Black communities.
Despite the challenges, Crabtree says it's important to put aside biases and finger pointing on both sides to come up with a solution that benefits all.
We're not here to blame, but what we're here to give you food for thought as to what am I doing today? What are my biases?
Last year, Marion County distributed nearly 7,000 naloxone kits, with 22% going to people who identify as Black. I'm Malia Van Ostrand, Wish TV, wishtv.com, or follow us on Facebook for updates.